In this screencast video lecture, we try to learn about the roundworm, that is Ascaris. It is a kind of worm which causes the disease called as ascariasis, which is a parasitic infection caused by the roundworms Ascaris lumbricoides. These roundworms are most commonly occur as intestinal parasites in the human. Females measures about 20 to 35 cm long with straight tails, whereas males are smaller but 15 to 31 cm and they have a long, cylindrical and unsegmented body with curved tails. Adults of both the sexes possess 3 lips at the anterior end of their body. This infection occurs primarily in the areas with the poor sanitation and hygiene, as commonly they spread by the contaminated food, water as well as soil resources. Now we look at into the life cycle of this pathogen and its transmission. Ascariasis disease is transmitted via the fecal oral route, meaning the eggs of the parasite are found in contaminated soil or water. When a person ingests the eggs that have been present there in the unwashed vegetables or even the contaminated food, or they may be even sticking there to the dirty hands also. When this particular eggs have been ingested, the larva will be hatching there in the small intestine. From the small intestine, the larva migrate through the intestinal wall into bloodstream. Further, they have a chance to travel to the lungs and even move to the throat of a person, where they may be again swallowed back. That results in the moving of this larvae back to the intestine. The larvae matures there in the intestine into adult worms, reproduce. This leads to the release of more eggs there into the environment, mainly through the feces. So this is a process by which the cycle tends to continue. Next we look at into the symptoms of the ascariasis. The infection not show any symptom in 80% of the cases. The severity of the symptoms depend on the worm burden, that is number of worms that have been present there and on which particular stage of the life cycle the parasite was present. So these two things determines the symptoms on an individual. Many individuals with mild infections may be asymptomatic, but when symptoms occur, they are generally divided into 2 types of symptoms, that is early stage symptom, which is mainly caused by the larval stage of the roundworms, and the late stage symptoms that are caused by the adult roundworm stage of the organisms. First, we look at into the early symptoms, that is commonly occurring through the larval migration phase. That is, in that particular phase, you can able to see these symptoms in the host. So it occurs when larvae migrate through the lungs. It is around 1 to 2 weeks after the infection. The following are the respiration related symptoms that could be easily diagnosed. It includes coughing, wheezing, chest discomfort, and it can be like a pneumonia or asthma like symptoms also. Sometimes these symptoms are referred as a Loeffler's syndrome, wherein a condition in which the larva migrate through the lungs, which causes an inflammatory condition. The next comes the late symptoms, that is the adult worms when they start multiplying there in the intestine. This kind of symptoms could be easily diagnosed. Once the worms settle there in the intestine, usually a few weeks after the infection, symptoms related to intestinal blockage and irritations may arise. This includes abdominal pain or discomfort, nausea and vomiting, intermittent diarrhea or constipation like conditions, weight loss or a poor growth in the children, mainly due to the malabsorption, that is poor absorption of the nutrients. The next one is a loss of appetite or changes there in the appetite of a person. It may lead to a condition of anoxia also. The next symptom is bloody sputum. And the last one, which is a severe condition, is the presence of worms there in the stool. In some cases, the adult worms may be passed in the stool, or it can be seen coming out of the mouth or from the nose of the persons also. So that is an extreme condition in which the worms have been multiplied in a huge amount. Next one, we try to look at the complications. What are the things that have been happens after this infection? The first one is intestinal blockage. A large number of worms can able to obstruct the intestines, leading to severe pain, bloating as well as vomiting. Sometimes the next stage, that is biliary or pancreatic duct obstruction, could be possible by these worms also. In rare cases, the worms can migrate to the bile ducts, liver or pancreas. It can able to cause pain and lead to the jaundice condition or pancreatitis condition. The third one complication that could be resulted due to these worms is malnutrition. Heavy infections of this roundworm results in the malnutritions in the children, mainly poor growth, that is referred as stunted growth, and very poor development of the cognitive domain of the persons. It can be mainly related with the imbalance or a poor absorption of nutrient in these children. Next, we look at the diagnosis conditions of this particular organism. The roundworms can be diagnosed in the egg stage, mainly in the stool samples, at least 40 days after the onset of the infection. This can be done with the help of a microscopic examination of the stool samples. In certain complicatory cases which I have listed earlier, that is in an intestinal blockage or in a pancreatic duct obstruction, we need to go for other imaging techniques such as X-rays, ultrasound or CT scans. This can able to detect the presence of worms in the intestine or even in the other organs which I have listed. The third one is the treatment. What are the medicines which can be used to treat this particular infection? They are all commonly referred as anti-helminthic medications. The term helminths refers to worms that have been commonly present there in the intestine. So these anti-helminthic medications can able to kill the worms that have been present there. It includes 3 different drugs, mainly albendazole, bebendazole and ivermectin. These drugs effectively kill the adult worms, and treatment is typically of a short duration, 1 to 3 days. Under severe cases, that is blockage or complication that are resulted by the multiplication of these worms, surgery may be required. Next, we look at the prevention. What is the prevention methods which we need to adopt mainly to get rid of this infection? It includes improving sanitation, that is proper disposal of the human waste, and promoting hygiene practices, simple hygiene practices such as washing hands, cooking food thoroughly and avoiding usage of the contaminated water, which are all the crucial steps in which the pathogen could be transmitted to the new individuals. These sanitation procedures could help in reducing the spread of the ascariasis. This image that has been released by the Center for Disease Control in USA shows the life cycle of this particular Ascaris lubricoides pathogen. So if you look at here, in the feces, you can able to find a lot of unfertilized eggs which will not further undergo any development, whereas the fertilized egg can able to form into certain infective stages. The L3 form of a larva, that is a stage of a larva that have been formed from the embryonated egg, if it is ingested through the person, that is mainly through the feco-oral mode of a transmission, by a dirty hands or by contaminated vegetables, this embryonated egg that forms into the larva is ingested means it will be entering there into the intestine. In the intestine, the hatched larva enter into the circulation and they can able to migrate further there to the lungs of the person. Larva present in the lung can be coughed up and they can be further swallowed there and they can able to re-enter into the gastrointestinal tract where this particular larvae gets matured and they form into a fully grown roundworms which can be present there in the small intestine. So these roundworms will again lay the eggs. That eggs will be reaching there into the fecal content and from again the feces, the whole cycle will be continuing.